Now to the coronavirus pandemic. Will a fourth COVID vaccine dose be needed to fight the virus? U.S. health regulators are looking closely at this and hinted that a second booster shot might be recommended later this year. Joining us is our chief health editor, Dr. Partha Nandi. Dr. Nandi, with our COVID-19 numbers continuing to drop, why is a fourth dose being discussed?
And there's still a lot of uncertainty when it comes to the coronavirus, right? While COVID numbers are still looking much better here in the U.S., there are a couple of key things that health officials need to keep a close eye on. First, are the new variants that could pop up, like Omicron subvariant BA2. Now, BA2 may be spreading slowly in the U.S., Brian, compared to the original Omicron, but it's become the dominant variant in countries like Denmark. And we can't ignore the fact that hospitalizations and deaths in that country have since increased, which is not good news. The other key factor we need to watch is our vaccines. Vaccination and booster shots really help bring our numbers down when fighting Omicron, right? But new research has shown that the booster shots can decrease in effectiveness with time. Right now, Pfizer is studying a fourth dose, an Omicron-specific vaccine for folks aged 18 to 55. We may or may not need this fourth dose, but research will definitely guide the decision, which is, I think, really important to understand. Plus, it's important that we're prepared for what may come next.
Doc, a fourth dose is available already to certain people right now. When might a fourth dose be available to everyone if this goes through?
That's right, Brian. Back in October, the CDC updated its recommendations. They allowed folks that are moderate to severely immunocompromised, meaning that they have a weakened immune system, to get a fourth dose of either Pfizer or Moderna's vaccine. And the reason why is this. That research showed that these people had a poor response to the initial vaccine series, and that increased their risk of severe COVID-19 and even death. As for when a fourth dose might be available for the rest of the general public, I'm hearing that it could be offered in the fall if approved. Right now, I feel our vaccines are working well, and booster shots are still offering high protection. So once again, I stress the importance of getting vaccinated and then boosted if you've not already done so. And if you haven't been vaccinated, please make sure that you're following all the precautions necessary to save yourself and your community.
Dr. Nandi, as always, grateful for you lending us your expertise. Thank you.
Thank you. Have a good night.
You too. And if you have a question for the good doctor, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or Twitter.